Hello, good evening. Welcome back to MEDucate. Today we're going to look at Alzheimer disease drugs. Alzheimer disease is a brain disorder that is irreversible. This is caused by development of a protein that affects the normal functioning of the brain. Examples of the Alzheimer disease drugs are here. We have the dompenyl hydrochloride and galantamine hydrobromide. Then we have memantine hydrochloride and we have rivastigmine tartrate. These are the common examples of drugs that are used to manage the disease. Indications of these drugs are dementia. Dementia is a group of syndrome or symptoms that result from the Alzheimer's condition type. So these drugs are used to treat the mild and even moderate form of Alzheimer's disease. What are the mechanisms of action of Alzheimer's disease drugs? Uh, as we know that this disease is linked to deficiency of cholinergic neurotransmission. So drugs such as cholinesterase inhibitors are used to manage the condition. So these drugs work by increasing acetylcholine through reverse inhibition of its hydrolysis. So improving the quantity of acetylcholine and also improving the cholinergic function. A typical example like memantine, which is the NMDA receptor antagonist, it's used to prevent persistent activation of NMDA, therefore reducing excitotoxicity. Going to side effects or adverse reactions, we have weight loss, anorexia, diarrhea, nausea, vomiting, dizziness, headache, bradyarrhythmias, hypertension, which is mostly from memantine, and constipation. What are the contraindications of the Alzheimer disease drugs? In patients that are hypersensitive to the drugs, it can be used cautiously. Also, may potentiate neuromuscular blockade, such as the succinylcholine. These drugs should be used cautiously with drugs that slow heart rate, which increase the risk of heart block. They should also be used cautiously with NSAIDs because they tend to increase gastric acid and therefore the risk of ulcers and GIT bleeding. Use the drugs cautiously also in renal or hepatic impairment. Some of these drugs are not recommended in the severe impairment. Use cautiously in asthma or COPD patients. This brings us to the end of today's class. Until next time, please remember to share, view, comment, and subscribe.